Hearing loss is affecting more people at a younger age, and yet many people choose to ignore the signs of hearing loss instead of seeking help. But there are ways to hear what you're missing, and joining me with more today is Daryl Will. Daryl, it's nice to see you.
Thank you for having me.
Well, you know, you sent me some really amazing statistics from Hearing Health Solutions. 31 million Americans suffer from some sort of hearing loss. 31 million. So are these necessarily seniors or aging boomers, or are people losing their hearing younger?
Well, it's a combination of all of those factors. We fit infants, we fit children. There are about 15% of the baby boomer population that have hearing loss, those that within the range of about 48 to 65 years old, and about 30% of the individuals over 65 have hearing loss as well.
Which is amazing. Daryl, you work at Hearing Health Solutions, so you will see people come to you, and it's been years that they've had signs and symptoms of hearing loss, and they've really waited a long time. Why do people do that? I mean, my father's one of those. We kept saying, really, Dad, you know, you can't hear.
Well, oftentimes the hearing loss occurs so gradually, the person with the hearing loss doesn't even realize what they're missing. And usually it's others in their family or friends that point it out.
That's a good point. So what are signs for people around them and for the person themselves to know that this is something serious and I should go see someone like you?
Well, if they are turning the television up louder than what others prefer or having people repeat frequently, those would be indicators.
If you have to say, what are you saying again and again, then that's an indicator too.
That's right.
There are so many different now hearing devices that there really is no reason for people not to come see you. Let's talk about some of those devices.
Sure.
What are some of the best ones that are out there now?
Well, there are a lot of different styles of hearing aids that are available. There are traditional styles such as the behind the ear, going all the way down to the custom-made completely in the canal hearing aids. They also have some of the sleek and discreet miniaturized behind the ear hearing aids, and we now carry a new product on the market. It's called Lyric, and it's an extended wear hearing aid. It's extremely small. You can wear it 24/7, so you can shower in it, you can exercise in it.
Is that this?
That is the one.
All right, you know what, this is really hard to show. It is so tiny. Do you surgically insert this?
No, an audiologist would insert that inside of the canal. It does fit deep inside of the canal, close to the eardrum, and the audiologist would remove it as well. So about every 3 months we have the patients return to our office. We take that out and insert a new set.
What are some of the advantages of the different type? Does it depend on what kind of hearing loss they have? Are there different types of hearing loss?
Well, the style of hearing aid is really determined by the amount of hearing loss that a person has and the size and the shape of their ear canal as well.
Oh, I never thought about the actual physical part of the ear having a difference.
Absolutely. We also take into consideration the lifestyle of the individual. So if a person is active, we may suggest a higher level of digital technology for that individual because they'll do a better job in changing listening environments.
Older folks, sometimes because they are more technically challenged, may be a little afraid of some of these. How do you convince someone to give it a try?
Well, with the new technologies, especially the digital technologies, there's very little that they need to do. The hearing aids do all of the work for them, and they are fully automatic now.
What's the process? If someone suspects they have a hearing loss, what do they do?
Well, the first step in obtaining hearing aids is to have a hearing evaluation. So we want to determine the amount of hearing loss that they have and the type of hearing loss they have. We also feel that it's in the patient's best interest to see a physician prior to obtaining a hearing aid, preferably one that specializes in diseases of the ear.
Some of the diseases of the ear then are physical and they can't be helped by hearing aids? Is that the reason why you want to make sure what the real cause is of the hearing loss?
That's correct. Sometimes medication or even surgical procedures might be available to take care of the hearing loss instead of amplification.
And so once that's established, how long does it take to really figure out what that person needs and then they come home with a new hearing device?
Well, sometimes with some of the new products, they can be fit the same day that we actually see them in the office. Absolutely. And in other instances, if they're custom-made products, it usually takes about 10 days to 2 weeks to receive them back from the manufacturer.
So it really is a process.
Absolutely.
But the best way is to go see somebody like you, and then you can decide what they need and what type, best fitting, all those sorts of things.
I think that's the best case scenario, yes.
Daryl, thank you so much. It's nice to have you here.
Thank you very much.